Should I be concerned if I have a bunion that doesn't hurt me? And the short answer to this is yes, because unfortunately, if a bunion isn't hurting you, it doesn't mean that there's not something going on underneath the surface. So make sure you watch this video. I'm going to talk to you about why it's important to try and get this checked out sooner rather than later. My name's Daniel Fitzpatrick from Sydney Foot Solutions. We see lots and lots and lots of bunions. We do a lot of work around bunions and we help people avoid bunion surgery. In fact, we see over 100 bunions a week through our clinics. Now, the reason that I think you should be concerned, even if your bunion doesn't hurt you, is that there is a very high rate of osteoarthritis, which will eventually turn significantly painful and affect your quality of life if you don't do anything about it, associated with bunions. In fact, one landmark piece of research showed that about 70% of the population has osteoarthritis through their big toe, which is a staggering amount of people. But what we find is that people will come in and say to me, oh, but my bunion doesn't hurt me. And sadly, in most cases, eventually it will. The problem is once it starts to hurt you, the bunion is already in a very advanced state, and it's often limited how much you can actually help that through conservative management approaches. So that is the significant concern that we would associate with this. So what I would strongly advise you to do is if you do have a bunion and it doesn't hurt you, I would get it checked out by a professional. This is part of the reason that we offer a 60% off initial bunion assessment, where people can come in and get their bunion checked out and they can find out more about how they can manage their bunion and also effectively treat their bunion without having to get to the point where they're backed into a corner and surgery is their only intervention and only option. The reality is there's lots you can do with a bunion. There's lots you can do before you need surgery. So make sure you get it checked out by someone who is an expert in this field. We have done this for over 20 years, and that's why we offer that bunion assessment. In terms of what you might say, what are my treatment options? The reality is that we see stacks of bunions. You can use exercise, you can use manual therapy, you can use laser. The way we do it is that it's a gentle hands-on technique where we work on correcting that level of alignment. We give you strengthening exercises to actually put your foot back into hold your foot back into a better position. And then we use laser to break up that pain and inflammatory response to speed up that healing. This can work really well. In fact, we do before and after x-rays on everybody, and we do see significant improvements through those areas. So if this sounds like something you might like, and you might like to avoid the need for bunion surgery, even if your bunion doesn't hurt you, I would strongly advise you get it checked out sooner rather than later. Go to our website at sydneyfootsolutions.com.au and claim the 60% off initial bunion assessment so you can avoid the need for surgery.